Karen, my name's Melina. I'm going to be your student nurse today, and today we're just going to be doing an assessment, okay? And before we get started, I just want to verify your name and date of birth.
Karen Lawhead, 2384.
Perfect. And Karen, I just want to ask you some more questions. Are you in any pain at all?
No.
No. And do you have any allergies?
No.
Nothing? Okay, perfect. So the patient appears their stated age. Their facial features are symmetric. They are sitting comfortably and erect, and there's no signs of distress present. And Karen, I'm just going to ask you some more questions. Can you state your name again for me?
Karen Lawhead,
And your date of birth?
2384.
And do you know where you are?
Chamberlain,
Chamberlain, and do you know why you're here?
for an assessment.
Perfect. So the patient is alert and oriented times 4. And then for body stature, the patient appears, or the height appears within normal range for age and genetic heritage. The weight is within normal limits for height and body build. The extremities are symmetric and equal bilaterally. Right, so the patient is calm and cooperative with the examiner. The patient is sitting comfortably and erect. The patient interacts pleasantly with the examiner. The speech is articulate, and the patient is well groomed and is dressed appropriately for the climate. And then the next thing that we'll do is vital signs. So I would just state that the vital signs would be in normal limits for the patient. And then the next thing that we'll do is head. So I would just state that the patient's skull is symmetric and smooth, and there's no lesions or infestations noted, or no tenderness to palpation. It's normocephalic, and the hair is thick and it's evenly distributed, and it looks clean and shiny. And then the next thing I would look at is the facial skin color is even and has pink undertones, and the eyebrows are symmetric and bilaterally. Next, the facial features are symmetric. And then I would look at the eyes. So the eyes are aligned with no protrusion or no like sunken appearance. And then there's no ptosis noted. And then the sclera is china white. The conjunctiva down there is pink and clear with no like lesions or no lesions. And there's no scaling on the face as well. And there's no discharge of the eyes. And then the next thing I'll do is the nose. So the nose is symmetric and it's proportionate to the face. The nose has no lesions, and I'm going to be looking inside now, Karen. So I'm going to be looking at your mucosa. So the mucosa is red and moist with no like discharge, no lesions, and the septum has no deviation or perforation noted. And then Karen, can you hold one nose and blow out for me? The other way. Perfect. So the patient has patency bilaterally. And then the next thing I'll do is the lips. So the patient's lips are pink and moist with no cracking or lesion. And Karen, can you open your mouth? So the patient's gums are pink with no swelling or bleeding noted. The teeth are intact and white with no caries or debris. And then the transverse rugae, or the hard palate, has white transverse rugae with no lesions or nodules present. Same with the buccal mucosa, it's pink and moist. Sorry, Karen. And then the soft palate is pink as well with no lesions. And then one more time, Karen, can you say ah for me?
Ah.
So the uvula is midline and moves with phonation. then Karen, I did forget with your eyes just to do some tests, okay? So I'm just gonna look at your eyes and I'm gonna flash the pen light and just keep looking forward, okay? Other side. And then Karen, if you can look at the pen light and I'm just gonna go forward, okay? Just keep looking there. So then the pupils are equal, round, and reactive to light, and they accommodate. So Perla is noted. And then Karen, can you follow my pen light as well? Alright. So just with your eyes, okay? So we're gonna go forward.
Are symmetric, including eyeballs bilaterally. Nasal labial folds inside of mouth.
Alright, so the patient shows parallel tracking of both eyes, and cranial nerves 3, 4, and 6 are intact. Right, so then I think we got that covered. So then the next thing I'll be looking at is the ears. So the ears are symmetric bilaterally. There's no lesions and no like thickening or swelling of the ears. There are piercings noted on the outside. And looking at the external meatus, it's pink and there's no lesions as well, no swelling. And then here, and I'm just gonna look behind your ear, okay? So there's no skin breakdown or tenderness present. And I'm just gonna palpate your tragus, okay? Any pain? Alright, so there's no pain or tenderness with the tragus, okay? And then one last test for your ears. Can you cover one of your ears for me? And I'm just gonna whisper a word and you tell me what it is, okay?
Pizza.
Perfect. And the other ear?
Sushi.
Perfect. So the patient is able to hear the whispered word, and there's no use of hearing aids or other assistive devices. Alright, so then the next thing that we'll do is the neck. So the patient's head is positioned centered in the midline with the symmetric accessory muscles present. And let's see. I'm going to be doing a test on you, okay? So I'm just going to put my hands on your shoulders and you're going to push up, okay? Perfect. So cranial nerve 7 is intact. And Karen, can you move your head left to right and up and down? Perfect. So the patient doesn't have any limitations in range of motion in her neck. And then neck, I don't see any like pulsations, no masses or lesions. Okay, and then the next thing that I'll do as well with the neck is just feel for her carotid pulse. So I'm just gonna listen or feel on one side. So the patient has 2+ carotid pulse strength with fast upstroke and slower downstroke bilaterally, and the trachea is midline. So then, Karen, the next thing that we'll do is listen to your respirations, okay? So I'm just gonna listen. But before we do that, I'm just gonna say that the patient has unlabored breathing and no use of accessory muscles, okay? So if you can just breathe in and out for me, and then I'll just listen, okay? That's the right upper lobe.
And you have
The
any
left
history
upper
for
lobe.
exposure to environmental noise? No history
The
of
left
exposure
upper
to
lobe.
environmental noise. And how do you
And
clean
the
your
right
ears?
middle lobe.
With Q-tips. Okay. Now we'll advise the patient that he should
And
use
the right lower lobe.
and cleanse his ear with soap and warm water.
And the left lower lobe. Okay, and I'm just gonna listen from the back. So just turn around for me. Thank you.
And we're going to start with the just external structure. So nose is symmetric and the lip line.
The left upper lobe.
And then we're going to move into the internal
Right upper lobe.
Um,
Right upper lobe. left
Nasal
below,
mucosa is light and moist, with smooth
left
surface,
lower
no
lobe,
swelling, discharge, or bleeding.
right
With
lower lobe.
foreign bodies.
So the lungs are clear upon auscultation with no adventition sounds. No, and I heard bronchial, bronchial-vesicular, and vesicular sounds. And the lungs are clear. So Karen, the next thing I'm gonna do is listen to your heart, okay? But before that, I inspect that there's no JVD present, and I'm going to listen to see if you have any roots, okay? So there's no roots present upon auscultation, and I'm going to feel for your carotid, alright? One at a time. And it's 2 plus strength bilaterally with your carotid artery, okay? And I'm going to listen to your heart now, okay?
Because I was like, I can't see how the camera is, but you guys were like squinting back.
So this is the aortic, and it's in the right side, second intercostal. This is pulmonic, and this is the left side, second intercostal. This is earth, and this is the left side, third intercostal. This is the tricuspid, and this is in the left, fourth intercostal. And this is mitral, and this is the left midclavicular line, fifth intercostal. And I would auscultate for 1 minute. Right, so I got 74 beats per minute in regular. And with your heart sounds, I auscultated S1 and S2 with no heart murmurs or extra heart sounds. And Karen, the last thing with your cardiac that I'm going to do is feel for your radial pulses, okay? So it's 2 plus bilaterally, and I'm going to count, okay? So I got 74 beats per minute in regular with 2 plus strength bilaterally. Right. So then the next thing that we'll do, Karen, is the abdomen. So if you could just lean back a little bit for me, and we're just going to examine it. Okay. Thank you. So the abdomen is symmetric on both sides. There's smooth contour, homogeneous color. The umbilicus is inverted, and there's no crusty, no redness, no inflammation present. And the next thing is I will auscultate for vowel sound. So I'm just gonna start on the bottom.
Okay. Bronchial, bronchiovesicular, and vesicular sounds are auscultated. Lungs are clear, no adventition sounds. And now we're going to move to the cardiovascular system. There is no, I can have you facing forward one more time. There's no JVD inspected. Then we're gonna check his carotid. Smooth contour with a brisk upstroke and slower downstroke.
So there's
palpated
vowel
with
sounds
moderate
present in
strength
all
up
four
to
quadrants.
bilateral.
And I'm also just going to listen for
And
any
auscultate
abdominal
for release.
aortas or roots. So I'm just going to switch it to the other side. And there's no birds auscultated. And then I'm just going to palpate your stomach next. Okay? So that means I'm just going to feel around. Let me know if you have any like pain or tenderness.
Cardiac.
You're okay? Alright. So the patient has no pain or tenderness with palpation. And I also wanted to mention that there is intermittent waves of paracelsus. So that's it with the abdomen. Thank you. And then, Karen, the next thing that we'll do is just your musculoskeletal system. So I'm going to be testing your muscle strength, okay? So I'm just going to push against your forearms here, and you're going to push up, okay? And I'm just testing your strength. Perfect. And then other way. And then I'm going to go out here and push out. I'm going to go in
And
here,
while I'm doing
push
this,
in.
I'm gonna auscultate.
And then I'm going to go down to your leg. Same thing, push out. And push in. And then push out. And then push in. Perfect. So the patient's muscle strength is 5 bilaterally, equal on both sides. And Karen, I'm just going to test your range of motion. So can you flex your arms for me? Can you extend for me? Can you abduct for me? Go out and adduct for me. And can you circumduct your arm and other arm? Be careful. Perfect. So the patient has range of motion in all joints tested. And I'm just going to feel your skin, okay? So the skin is warm. There's no swelling in the joints. And no tenderness with movement. And I'm also just going to palpate for the dorsalis pedis pulse.
And regular. Now I'm going to do his radial pulses.
So the dorsalis pedis pulse is present. 2+ strength. Right. And then Karen, with your skin, I just forgot to look at your nails, okay? So I'm going to see that the nail beds are pink and the edges are round and there's no, the edges are smooth, and I'm just going to test for capillary refill. So capillary refill is less than 3 seconds, and I feel that the skin is nice and warm, and I'm going to check retention, okay? So I'm just going to go right on top of the clavicle. And there's no tenting noted. Alright, and Karen, I think that is it. Do you have any questions for me before I leave you?
Nope.
Need any water, bathroom?
No, I'm good.
No? Okay. Well, thank you so much for allowing me to be your student nurse today. I really appreciate it. The call light is going to be right next to you. I'll get it for you before I leave. Oh, it's right here. And then, you know, let me know if you need anything. I'm just going to be down the hall. The doctor should be in like 10 minutes, okay?
Okay, thank you.
Yeah, thank you so much.